The honest answer is that we do not have a clear cause, as in we don't have a clear, as in like if we say 1 + 1 = 2. So there's no clear pathway where we say there is a fibroid, therefore there is infertility. However, there is an association between having a fibroid that is submucosal, where I mentioned that is closer to the lining of the womb, and perhaps delayed infertility or recurrent pregnancy loss or higher miscarriage number and so on. But this is just an association. So there is some trials where they looked into, do we remove a fibroid if someone, for example, having recurrent pregnancy loss or they have an infertility, whether that it will improve fertility afterwards? And the answer is still unclear. These trials were small. So there's no strong guidance. If someone having subfertility and they have a big fibroid, do we actually remove it to improve their fertility? So far, the consensus seems to be it depends on their location and depends whether they're impacting the uterine cavity or not. And when we are hoping to optimize fertility, what we want to see is that the inside of the womb is regular, even if there is a fibroid within the muscle of the womb, but it's not breaching into the cavity of the womb. We seem to think that there is less impact on fertility. So some of the key tests that we would do as fertility specialists, unlike say in the community, is something called saline infusion ultrasound scan. And I recommend having this done before any surgery or taking a decision about that. And what we would do is that we will infuse a little bit of water inside the cavity of the womb and take an image with the ultrasound so that we can see if a fibroid is actually indenting. I'm getting a bit technical, but
oh no, we love this.
Yeah,
I'm like,
yeah.
whoa.
because this is very important. I see a lot of patients who get exposed to completely unnecessary fibroid surgery that then cause complications such as adhesions inside the lining of the womb that makes their infertility case worse. So it's very, very important to get the right assessment and really have a frank discussion with the patient. Would you really benefit from removing this fibroid versus potential risks? And this will only happen when you do the right test and speak with the right fertility specialist.